Hey guys, it's Dr. Kylie. I get a lot of requests. I teach every Tuesday on Systemics Facebook page. So if you're not there, go join us. I get a lot of requests for me helping you think through a difficult patient. So if you have one of these hot mess mamas or just a hot mess in general who has a lot of symptoms, maybe even a load of diagnoses, and you don't even know where to begin, I'm going to walk you through this 27-year-old. She just got married a couple years previously to this, and within the last 12 months, her health tanked. She has gained at least 100 pounds in a year, and the funny thing is she's not able to eat anything. Whatever she eats, she throws up, and yet this weight keeps gaining and gaining and gaining. So I want to show you to begin with what her questionnaire looked like. I use this medical symptom questionnaire with everybody to get a baseline of where they're at. And that way, when I pull their medical records to look at the numbers, I can compare the way that they feel with the labs and make sure their story is complete and I'm not missing anything. So if you take a look at this is page 1 of 2 of her numbers. She's got the 4 is frequently and severe. The 0 is never or almost never, and the 1 is occasionally but not severe. So they rate each symptom based off of how intense is it and the frequency. And then at the end, we add it up. So as you can see, she's got a fair amount of 4s. She's got 4 on the headaches. We even have eyes, ears, nose, all with symptoms. Every system that's marked on this questionnaire has symptoms, but her biggest one right here is the skin. We've got a 4 on acne, hives, a 4 on hot flashes. Remember, she's 27 years old. A 4 on excessive sweating, and then a 2 on hair loss. This poor 27 years old, and mind you, let me tell you also, she's probably on 15 different medications, one to help with this, the one to help with the side effect, you know the story. And then she's also been taking probably the same amount of supplements, just trying to find something that will help her feel better. I'm going to switch over to this other screen here that will show us the second half of her questionnaire. So finally, we get one with 0. Lungs have 0 in it. Then we get into the digestive tract, and I key in on the digestive tract. So we have 1, 2, 3, 4, 5 number 4s out of 7 different symptoms. The number 3 is a nausea. The number 1 is heartburn. So we're dealing with diarrhea, constipation, bloating, filling, gas, belching, and then even stomach pains. Those are all 4s. She's at a 24 total in the digestive tract. Then we get into the joints and muscles, and every single symptom in regards to joints and muscles is a 4. Weight. Every single marker underneath weight is a 4, except for I am underweight, right? So this 27-year-old girl is in some major, major distress. And if you were to look at this, it's like, where do you start? She's a high school chemistry teacher. And at this point, I saw her last fall. So just as they were entering into the 2020-2021 school year, when everything was being manipulated, but as far as her health goes, it had been the last 12, 15 months. Her energy levels, gone. She was very grateful for being able to teach over Zoom, because that way it was less strenuous on her. Her mind's doing pretty good. 0s across the board, which is pretty rare. And to be honest, a lot of times I see people with brain fog and mind game issues. The emotions are, of course, all over the place because she feels like crap. Mood swings, anxiety, anger, irritability, depression. We have frequent illness. Like I said, she's constantly throwing up. Nobody can figure out why. And then some additional markers. So overall, her grand total is 152. She is one hot mess. The highest I've ever seen is just over 200. I believe it was 228 And then the lowest I've seen, he was 17 years old at like a 17. So she's probably pretty standard, pretty average for the people that I see taking this questionnaire. And the nice thing is when you can help somebody out that's this bad, the questionnaires look really good in 3 months if you're doing things right. And I want to focus right here with the digestive tract and the joints and the muscles. When I come to a patient like this, I think of 4 different avenues, and I call them my 4 phases. I'm going to walk each person through each phase, and the phases are going to be a little bit different depending on their symptoms and how they're feeling. So the first phase is gut destruction. Right here, I see constipation and I see diarrhea at 4s. I know she's got major digestive tract issues, so I'm automatically going to think SIBO. But I want to go back to the numbers to make sure and to double check that we're not dealing with viruses or parasites as well. Then, from my experience, and I'm sure you guys understand this too, when you tackle SIBO, I've never had this not happen. Don't jinx myself, of course. I tackle SIBO, I take care of it correctly, the joints and the muscle pain goes away. The weight gain starts to fall off because now she's starting to absorb her food and her body's not fighting something. And at the end of this, I'm going to show you the personalized supplement calendar that I wrote out for her based off of the symptoms and based off the numbers we're about to go over. Now, I don't have time to go over with you why the numbers are the way they are. If you want to learn how to read a CBC and a metabolic panel and the blood work in a unique way that I'm about to do so, I'll have the links to the previous webinars that I did last year for systemic, where I teach you how to read those things. So that being said, let's dive into her numbers and see what they say. Okay, so first we have this. Let me explain this document that you're seeing right here. Let me reset to. Well, what I have is a document that I received from a seminar that I went to. They'd compiled everything, all of the blood markers, the lab ranges that you see on the left, and then in that middle column, I have her labs. And when you see multiple numbers like this, so like right here, when you've got 3 markers for glucose, that's telling me that there were 3 different labs with that blood sugar marker. Okay, so down here, when we've got 3, that's 3 different labs, 3 different labs, 3 different labs. That's what you're seeing when there's multiple markers inside that results column. And then if one of her markers are outside of this functional medicine range, the range in which I did not come up with, Dr. Corizon came up with these, and he's at the Corizon Institute, one of those guys who has way too many letters next to his name, but someone had to do the research and figure out these numbers for us. So I didn't come up with these, I use them, and they work very, 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 very well. So here's the range, here's the results, and then on the right-hand column are my comments if they fall outside those ranges. And like I said, I don't have time to go in to teach you why they are what they are. We're just going to zoom through, and so that way you can see how I compile the symptoms with the numbers and then walk you through those 4 phases as I go through her supplement calendar afterwards. Okay, so we've got glucose, blood sugar dysregulation, which would mean hormone chaos. When BUN is low, like it is right here, we need hydrochloric acid in the stomach, which will help with the digestive issues. And let me say this too, all of these puzzle pieces that I'm going over, they're puzzle pieces. They're not the end all be all. They are part of the complex puzzle that we need to fix to have her whole body heal and happy. BUN creatinine, that one's high, so I'm going to maybe look at a detox. Sodium and potassium are adrenal markers. The 4.6 is off, so we're looking at some adrenal fatigue. Calcium compares to your vitamin D status. So when the calcium is low, I'm going to check vitamin D. Total protein and globulin are markers for leaky gut. Just got a couple of those outside the range, so we're going to worry about leaky gut. Again, it's not that leaky gut causes everything, it's just a piece of the puzzle. We have markers for detoxification with the ALK-Phos. We scroll down and take a look at this. 72, 42, and 40 for AST. ALT, 121, 90, and 92. Those are the highest I've ever seen it, and those are your liver markers. I remember her telling me that the doctor was like, oh, we're going to have to monitor those liver markers. And in her head, she's thinking, yeah, because I'm on so much medication that it's having to process all this medication and the supplements I'm taking. So ultimately, we're going to definitely work on the detox system and then help her body heal so she doesn't need the medication, so her liver doesn't have more crap to handle. Those are pretty high numbers. Cholesterol panel. The cholesterol panel to me means two things: one, inflammation, and two, thyroid problems. So we're at 166 there with cholesterol, which looks good. The triglycerides are a little bit high. So we're leaning towards some thyroid and inflammation there. Unfortunately, with all of her medical records that we pulled, there were no thyroid markers. Nobody bothered taking any thyroid stuff. Sometimes you're going to get a TSH. Sometimes you're going to get lucky and get some free T4, maybe some free T3, and maybe some TPO antibodies. You guys will know most people take TSH. When I'm running a thyroid panel or when people ask me what labs to run, here's a list. Ready? CBC with differential. It has to be with the differential. If it's not, you're missing some key pieces. Metabolic panel, thyroid panel, which includes TSH, free T3, free T4, and TPO antibodies, TG antibodies as well. Some people like to add in the reverse T3, but with my approach to the thyroid as a system, I want to know TSH, free T4, and free T3. I plug in the numbers into the cascade pretty well. The other markers that you want your patients to take, the other labs, I should say, in addition to the CBC with differential, the metabolic panel, the thyroid panel, you have them take a lipid panel. I also like getting HSCRP with the vitamin D, with the blood glucose, with the A1C. So the more markers you can get, the more puzzle pieces you have, the better you can complete the puzzle. Her vitamin D levels are at 37. Like I said, we want to have those vitamin D levels around 80. That's my goal. So right off the bat, I know that we're going to put her on 25,000, 20,000, and then 15,000 IUs per month. So 25,000 IUs a day per month for the first month, and then 20,000 for the second month, and then 15,000, and then 10. But here's the biggie. This is why you have to have a CBC with differential, because the differential part tells you what type of infection you are fighting. If you are dealing with somebody who is a hot mess and you don't know where to begin, always look for an infection. And you can do that with just a regular CBC, right? So your white blood cell count needs to be less than 5, greater than 8. If it is outside that range, we're fighting an infection. So 2 of the 3 markers, I know we have a chronic low-grade infection and probably some stress instigated the chaotic craziness happening inside her body with her health. Okay, now I'm not going to worry about these for now. I'll come back to them. What I want to know is what type of infection am I dealing with? And that's where the differential portion comes into play. So the neutrophils, the lymphocytes, the monocytes, the eosinophils, the basophils. These are the percentage markers. I don't know the conversion between the absolute values and the percentage, so try to give the percentage markers, which is what most of them come with. If not, they come with both. So neutrophils fight bacteria. You want to see these guys around 60%. And at first glance, when I looked at this, I was like, oh, 60%, 61%, that's right where I want it to be. Lymphocytes, they're at 30%, that's right where I want it to be, 32 and 30. Great, what in the world is going on? And then I caught this guy. So on one of her labs, we have a 47 and a 43. That tells me when it's a 1-to-1 ratio, that 1-to-1 ratio tells me we've got an autoimmune component going on. And that completely changes the way that you treat somebody, right? Because now you're having to figure out what is the trigger for the autoimmune, then calm down the immune system, then fix the gut. So if you were to get my cheat sheet on my 3-step autoimmune stop the attack kind of thing, find out the trigger. For her, this trigger is going to be an infection. And because the labs don't tell me exactly what kind of infection it is, I'm going to go back to her symptoms. We have diarrhea and constipation. SIBO, SIFO. I'm going to attack it. Second, I'm going to calm down the immune system with, of course, high doses of vitamin D that actually regulates the T reg cells. Other things to include for calming down the immune system are probiotics like MBC and ABC, and then the G cell for the glutathione. Those are 3 big components that I teach on my podcast, and I go on as a guest on other podcasts, and I teach them my 3 steps of calming down the immune system, stopping the attack. Do I know what type of autoimmune disease it is? Nope. Do I care? Nope. The only thing I care about is stopping the immune system, getting her healthy, and I'll show you how we do that with their supplement calendar. Okay. I also throw in the viral component right here because of the 43. When it's above 30%, I'm going to think more virus. And more often than not, there's going to be a viral component, especially if you're dealing with chronic fatigue anywhere in the mix of things. So then right up here, outside the infection, which is the number one thing you got to fix first, with the anemia, we've got, if there is anemia, I should say, anemia, infection, they got to get taken care of before you can do anything else. Methylation, B vitamins. So we've got 5 markers indicating that her body is unable to use B vitamins at an efficient level. Hence the low energy, the hair falling out, all that fun stuff. Now, I have heard from both her and her mother that when I gave her Moors, we did liquid Moors, she automatically noticed an increase in energy. So now mom wants it. And the funny thing is I was going over these exact labs in this exact way with her and her husband, who of a couple of years, they've been married for a couple of years. Her husband looks at me and he says, I wonder what you could do for me. So then we pulled his labs and I did it with him. And now they're buying $900 to $1,000 of supplements for 3 months, which I'll walk you through here in the next phase. But it didn't stop there. I have now pulled her mom's labs, her dad's labs, and the husband's sister's labs. So out of just this one route on how I was able to take the numbers, convert them into answers, healing, and hope, I now have pulled 4 other labs. Mom, dad, brother, husband, sister. 4 labs. 4 labs in the family, and it's probably just continuing to grow. And I should say it is growing because tonight I have a consultation with their best friends, who they sent over my way to pull. I pulled their labs. I read through their labs, and we're going to go over them today. So when you can dial this stuff in and you can tune in on the numbers and then compare the numbers with the symptoms, it's powerful stuff because numbers never lie. So once I've mapped out all of those components, what does it look like? Here's my treatment plan. Okay. So my 4-phase treatment plan, usually 1 phase lasts 3 months. But because she is 27 years old, I think we can speed it up. The younger you are, the faster you heal. So I'd have gut destruction for phase 1 that's going to last 2 months. Gut replenish includes leaky gut and gut replenishing. That's going to last 2 months in the 2nd phase. And then the 3rd phase and the 4th phase, you can flip as needed. Balancing hormones, detox. Usually I do the hormone balancing in the 3rd phase, and then the 4th phase is the detox, of course. But when her liver markers were so bad, we're going to do the detox first, then balance the hormones. And their plan is as soon as we get to balancing the hormones and I can start regulating out the PCOS, they're going to go for the baby. And here's why. They've been terrified to get pregnant up until this point because both of their health is awful. Her health, of course, you saw the numbers, you saw the labs. His health wasn't much better. He spent 2 years in South America and since then has never been the same. Found parasites in him, put him through the VRM 1, 2, 3, 4 protocol, and he's already feeling a million times better, to the point where a month after they started this regimen, I get an email from her saying that they feel better, both of them, but not only do they feel better, because they feel better, their anxiety, their mood swings have gone down, their relationship has improved. So she's like, you saved our relationship. I didn't save their relationship. Their willingness to open up and to take what I recommended has saved their relationship because it's improved their health. To the point now where, say, in the middle of the summer when their 9 months are up, I know he's on a 9-month plan too, they could do it together. They can start looking for that pregnancy route and know that they're going to feel good and not have a rough pregnancy. So when I get down into the hormones, we're going to do some PCOS stuff. Okay. So there's her symptoms. There's the numbers. I know that was fast. If you need help knowing why and what and how to read all these lab stuff, come join us on the Facebook page, Systemics Nutrition Clinical something. That page, that's where I teach the labs every Tuesday in addition to other stuff. And there's the webinars from last year in which I teach how to read the labs. When you can read the labs and become a powerful number dissector, you're going to have people coming to you automatically from referrals. Just like I've had, 7 new patients from this one individual. Okay, so let's get to another screen. With all that, where do we begin? So here is my personalized supplement plan for her. The first 2 months, of course, we're going to start off with gut destruction. And you'll notice that these plans are very, very, very basic. Simple. The more simple, the better, in my opinion. And patients love it too. So we've got Bactrex FunDX, vitamin D. Oh, geez. I feel like vitamin D should have been 2 and 2. Now that I look at it, I'm like, whoa, vitamin D is low. It needs to be way higher than that. But I do remember why I did vitamin D only 2 per day. Finances were a tight concern for them. So I kept it very simple, very basic, so that way they could stay within the 150-ish range per month. That was $300 per month for the 2 of them. They bought 3 months at a time, which is $900-ish. And when they buy 3 months at a time, I give them a 10% off discount. That way it's less shipping for me, and that way they have more of the supplements immediately. I'm not playing tag trying to get them to them. So Bactrex FunDX, vitamin D, more is due to the methylation stuff. And then whenever you're destroying, you got to include bind. Usually with bind, I start off with people at 2, and then I increase it every week. I think for hers, it was literally a financial decision because it's usually 2 per day, turns into 3 per day, turns into 4 per day after a week of each stage. And that way we monitor the bowel movements to make sure it's not going to cause any diarrhea. And if it's good, then we just continue to up it. So that's what I would recommend. 2 first for a week, then 3 first for a week, and then 4 and stick with 4. Month 2, after we've tackled the bacterial infection with a possible fungal infection, but FunDX also has that bacterial component. I stayed with the Morse because of those multiple markers, stayed with the vitamin D, added the antiviral component to attack the virus, which is also a huge instigator of autoimmune disease, kept her on the vine. Month 3. So this would be previously last December. She is now moving from the gut destruction phase into the gut replenishing phase that includes healing leaky gut. So Vista 1, Vista 2, L-Gut, and ROX. Vista 1 and Vista 2 and L-Gut are my powerful triple combination to heal leaky gut. And then once it's healed, you got to protect the cells with some antioxidants. So we've got ROX in there to protect. And then we're going to start replenishing. Now, usually the way I replenish is I start off with MBC, but knowing in the back of my mind that I'm going to speed track her from a 12-month program to a 9-month program, and MBC is included in prep phase, I started off with ABC. So ABC, DS, DB12, and Z-Gluten was her first month of replenishing. And like I said, 2 in the morning with breakfast every day, keep it very simple. Then month 5, we're doing which is this month, I should say, she's starting the prep phase, which like I said, has the MBC in it. So we're rotating those probiotics for a good variety. Moving into body phase, brain phase. Then finally, month 8 and 9, we're looking at her hormonal pattern of PCOS. Famicrin, Sinulin, PS. Those are golden for PCOS and balancing hormones. Throw in some Catabo shake if the breakfast sucks, and voila, you're going to have a huge benefit there. Now, what I told her and what she's planning on doing, she's taking these 3, mixing in PS, LS, and KS for as long as she needs. So like right here, it says, typically it takes 3 to 6 months for these to help balance PCOS hormones when pregnancy occurs. So she'll take these things until she discovers that she's pregnant and then help get monitored for pregnancy. And like I said, usually it takes 3 to 6 months for that to happen. But knowing that hormones are last, we've done all of the previous work. Last I heard, she's on month 5. She hasn't thrown up since before Christmas. The nausea's gone away. All of these symptoms, the pain, the fatigue, the mood swings, the anxiety, the depression, they're so resolved. Could I tell you what caused each? Nope. All I know is that when you fix the systems and make sure the gut works clean and it's moving efficiently, then you move into, so you destroy what needs to be destroyed, you heal leaky gut, you replenish it with the good guys, and then you move into hormones typically. And then last but not least, detox. But like I said, they can be switched. That's worked very, very efficiently. And I manipulate as needed based off of the symptoms and based off of the labs. So like I said, for her husband, when we're up here in the gut destruction phase, his gut destruction is VRMs 1, 2, 3, 4, WO, and bind because of the numbers in his labs. I knew that's what I needed to destroy. And then we go over to like the gut replenish and walk them down the lines. So that's my 4-phase system for attacking these hot messes. And I'm not throwing darts at all their symptoms. If you do that, they're going to be taking a million things and not really go anywhere with it. At least that's when people come to me. They're taking 25 different things 4 different times a day. And they go into whoever they're seeing, and they literally say to me, I feel like they're throwing darts at a dartboard and guessing. Like if I say, I think it's my thyroid, they're like, oh, it could be. Well, let's try this. This takes the guesswork out of it. Whether it's muscle testing or not, it's the guesswork gone, and numbers never lie when you know how to read the numbers correctly. Like I said, these are normal labs. They come in with me. I specialize in taking those normal labs, turning them into answers, healing, and hope. And that's exactly I do it for everybody. So there's your sneak peek into my 4-phase system for helping those who struggle with a whole plethora of symptoms, maybe even a plethora of diagnoses, and you don't know where to begin. Start with the numbers, start with the questionnaire, then move yourself through each of the 4 phases.